Good afternoon and hello everyone. Welcome to today's event, the Office Hour for Clinical Leaders and Care Teams Combating Misinformation and Disinformation Related to the COVID-19 Vaccination. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleagues. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this live event is approximately 60 minutes, including introductions, presentations, and Q&A. Again, the duration of this live event is approximately 60 minutes. We would highly encourage you, obviously, throughout today's session, we do have the chat box that's going to be located in the lower right-hand side of your computer screen. Simply type your comments, questions, or concerns into this box at any time during today's session. Please stay tuned throughout today's session. We're also going to be posting lots of fantastic resources for you as well. So it's really going to be nice for you guys to locate that box. As a little icebreaker I like to use, just so we know where that chat box is at, feel free to locate that right now. Let us know maybe what health center you're coming from, your city and state, maybe even the weather outside. Just go ahead and locate that chat box located in the lower right-hand side and just let us know where you're coming from today. Friendly reminders, today's event is being recorded and will be available for a playback at a later date. All attendee lines have been muted and will be muted for the duration of this event. Chat box is located in the lower right-hand side of your computer screen. Simply type your comments, questions, or concerns into this box at any time. At this moment, I'm going to be turning things over to Wanda, who's going to be introducing herself and our other speaker today and setting the stage. Wanda, the floor is yours.
Thank you. So I'm so excited to be here today and to be part of this exciting webinar. My name is Dr. Wanda Montalvo. I'm a nurse by training. Sorry, we talked about not having background noise, and of course I have one going on now. Sorry. I am a senior fellow at NAC for public health integration, but my background is that I have worked in federally qualified health centers, primary care associations, and foundations and academia. So I have a pretty eclectic background. I encourage those that are on social media to please follow NAC at NAC, NACHC on Twitter, and my Twitter handle is here. I have my PhD from Columbia University, and I am a fellow of the American Academy of Nursing. Next slide, please. And I am so thrilled to be joined today by my colleague, Dr. Tara Sell. And she is a senior scholar at Johns Hopkins Center for Health Security. I strongly encourage people that may be unfamiliar with the center to please visit the site and get familiar with the resources that they have there. She's an assistant professor, and her work focuses on public health policy and practice in order to reduce health impact of disasters and terrorism. And I will say that, interestingly, I tracked down Tara after listening to her present via social media to invite her to join NAC for this presentation. And so modeling how we connect with people and leverage social media to expand our social network, but also to identify content experts to help us at the national, local, and state level. Next slide, please. The learning objectives for today is to describe the differences between disinformation and misinformation, to understand the subversive tactics and harm that disinformation and misinformation have in our communities and public health. For attendees to identify at least 3 tactics to discuss misinformation and disinformation for those who may believe it. So colleagues, family, friends, our community, I think we're all grappling with this on a day-to-day basis. Leverage communication strategies to better promote health and digital literacy in our communities related to COVID, and discuss the importance of working with cross-section of partners to safeguard the community against disinformation and disinformation. Next. So in order to get us rocking and rolling here, we're going to launch a poll. We want to know on a daily basis during patient encounters, how often are you addressing misinformation and disinformation during a client visit?
And folks, that poll should be in the lower right-hand side of your computer screen. It should have popped up on your screen. I activated it just a smidge early, and we have a few votes already in there. So go ahead and select your response and just hit enter or submit. So we got that. So we'll go ahead and give it about 1 minute. Again, that poll question. The polling should have popped up on the right-hand side of your computer screen. So simply just select your answer and hit submit so we get that. So I'll go ahead and give that again one more minute before we go over the results, or Wanda will go over the results. Thank you. So many votes. Come on, people. This is awesome. It's like sliding everywhere. Okay, I'll give it about 15 more seconds. Perfect. Let's go ahead and lock this. Perfect. And Wanda, can you see the results on
Wow.
your end?
Yeah,
Perfect. Awesome.
I was not expect I was expecting it to be a little lower, but I think that when we are busy caring for our patients in a clinical setting or any, honestly, our health centers work across so many different sectors. If you have an allotted time for a patient encounter to take up that much to address the misinformation that they're grappling with, it kind of also shows the impact that this is having in our clinical care of patients. So it's a really big issue, and I'm glad that you guys are here. And this is, information that you can apply to your day to day. Next slide. So I want to thank the health centers that were part of a project where we did listening sessions across the country with the health centers that are listed here. And it was really important. It was a co-design where we interviewed both the staff and patients about their kind of ongoing struggle with dealing with misinformation, disinformation, how they were grappling with COVID, how they were accessing information. Next slide, please. And, I think to set the kind of record in the sense for folks is that we've been here before. We've had pandemics in the past, and it's crazy that we have this whole kind of debate about masks. And for children to wear masks, we did it in 1918, and we're doing it now versus 2020 is now 2022. We're 2 years in, and we're still having to, at least follow public health measures to keep our kids safe. Next slide, please. And the same with, using Lysol back in 1918, and we're still disinfecting and trying to keep germs away, and hand sanitizers and everything else to keep our communities, our homes, and our workplaces safe. So these, public health measures work then, and they work now. Next slide, please. So I wanted to kind of set the stage for this. We did these listening sessions using a virtual, Zoom meetings, partnered with Emory University. And I want to give a shout out to my colleague, Sarah Price, who was a co-conspirator with me on this project. And we conducted about 53 hours of interviews, both with patients and staff. And what was interesting was that we did it at like a 2 or 3 week space between the first and second conversation with the same people. And it was to better understand what were they were grappling with when it came to vaccine hesitancy. This is a couple of months before we had the FDA approval for Pfizer. But we had the distribution of all 3 vaccines being made available to the general public. So we wanted to get an understanding of, what they were grappling with and give us a sense of why you at this point have no plans to get vaccinated. So we were interested in those people that were still hesitant. And so their concerns that came up were that there was a lot of other diseases going on around the country, and there was no vaccines and no cures for these things. Why all of a sudden do we have this pandemic and we developed a vaccine overnight? And part of this was probably due to the naming convention that was used for developing the vaccine, which was, warp speed. But people didn't have a clear understanding of the long history of research that had been going on behind the scenes to develop the vaccine. A big kind of, I don't trust the government. They don't trust the pharmaceuticals. There's a lot of money to be made. in medicine, and why all of a sudden am I getting this medication for free when I've had to pay for all these medications before? And this is going into my body. It's scary. What are the ingredients? What are the side effects? And there was a lot of gap in knowledge, both for patients as well as staff. And I would say that that was one of the kind of key takeaways of listening to our staff. Was this initially when we started this, I did have this assumption that our staff would be more up to date and ahead of the information and understood. But what we learned from listening was that there was gaps in knowledge for both patients and staff. Next slide, please. We also we wanted to get a sense about why at this point have you no plans for getting vaccinated? And there was definitely a lot of fear mongering that was going on. The vaccine was developed too fast, and now you have to get a booster. So really a lot of confusion. They didn't understand the public health guidelines, why these things continue to change. So the ability to place the decision-making burden both on patients and our staff, and then being able to explain this is, I think, a heavy lift. And even now, we still have ongoing questions around where we are and the variants that come out. And I think we need to be, as health centers that are trusted in our community, we play a real critical role in helping to clarify information for our communities. And the complexity of this cognitive demand, being able to understand how things continue to evolve and being able to digest this information to make decisions is really, I think, a huge burden for a lot of people. Next slide, please. And the reliability of information. So one of the things that was really interesting, and I think a really important point, was that depending on the state, public health infrastructure and support had variation. So people in the front lines and communities either were getting accurate information on a regular basis or getting very sparse information. The other challenge is that information is often in one monolingual language and versus the multiple languages that we deal with on a day-to-day basis in our health centers. And so where people are going for that information varied. I don't really think a lot of people find reliable information from reliable sources. It's mostly, I'm not saying all people, but even for myself, I don't think I've researched it honestly on a reliable source. And one of the things we found from some of these conversations was that we would say, well, we say CDC has this information, but when we spoke with patients and with some of the staff, they themselves had not visited the CDC website, or they didn't quite know how to navigate and ask the right question and some of these things. So while the information is out there, we still need to kind of consider how we support people to gain access. I don't trust, one of the things that came out too was I didn't trust any of the images that came out of New York with those refrigerator trucks filling up with dead people. So again, this kind of media, I think, battlefield in some ways of people not trusting information and buying into conspiracy theories is something that has also impacted the ability for people to trust. And what we also regularly heard, which is why it's so critical that our health centers, get activated around this and promote information through their social media channels, is that you're trusted. So when we asked people, where do you trust? Who do you believe it's giving you accurate information? Over and over again, we heard that it was health centers and their, clinician, their physician and nurses. Next slide, please. And this is really what we learned or heard over and over and over again. I'm going to choose what I want to choose. I just feel like you got to go off your intuition. So for those people that were in the fence and trying to grapple with decision making, where they were receiving information really impacted the way they were digesting that information. And unfortunately, some of the platforms that they use perpetuated these lies. And so, they either got into Facebook groups or other, social media channels like TikToks and other news outlets that keep kind of perpetuating some of this misinformation and sometimes purposeful disinformation that is really, I think, causing great harm. Next slide, please. And just as an example, these strategies are well funded. They're not, just happening randomly. There's some strategy going around this to promote some of this disinformation and misinformation. This is recent here up in New York, where they put out a whole billboard about, stop the vaccine mandates, and another concerted effort to really identify doctors that are purposefully sharing disinformation and misleading people is having real huge negative impact. And they have a platform where the information, unfortunately, is reaching way too many of our patients and consumers on a day-to-day basis. Next slide, please. So some of the things that we also need to be aware of is that I think there is a stress that's going on among our clinicians and frontline providers. They're struggling and they're listening and they're having to face this on a day to day. I mean, just the fact that you're spending 4 or 5 minutes in a visit addressing this is concerning. And, as a provider, I worry about the people you don't see because they come annually every 6 months. You haven't had the chance for that one-on-one conversation. They're getting information on what's on TV or the news or anything else. The challenge is having time to discuss COVID while you're also taking care of all the other things that our patients come in with, right? Uncontrolled diabetes, uncontrolled asthma, and it's all within this 15-minute visit. And so there's this ongoing challenge, and therefore we need to think of other strategies to help promote the message we know is accurate for the safety of our patients and our staff and our community. Next slide, please. Some of the big themes that came from the listening sessions were that the sense that there's this big push for this vaccine. I know a lot of people are grappling with this. The vaccine may be unnecessary, or now that COVID is out and I'm still getting sick, why do I need the vaccine? It's not really working. So people don't understand how vaccines work. What's the point? They're lying about the side effects. This came up early on, and this ongoing kind of challenge with it's my body and it's my choice, and fear of, they're using the vaccine to control us. And people are really upset about the mandate. So it's like a lot of variation and issues kind of commingled in this kind of discussion about where people are, and this issue of they don't trust the vaccine for their kids is also another thing. But what was interesting was that as these themes arose, when we came back to the same group for a second conversation with more evidence and answered some of these questions and listened to their concern, they were more open to considering getting the vaccine. And then even for those that were really resistant, that didn't want to get vaccinated and really hated the mandate, after they got the vaccine, said they were kind of glad they did get it. So it's really interesting. But again, we're combating a lot of this issue because of the overwhelming, I think, tsunami of misinformation that people are processing. Next slide, please. So this is just one example of, how information, but either positive or negative sentiment, how strong and how quickly it can be disseminated across the country. And unfortunately, the negative sentiments it's like gaslighting, that, they get picked up a lot faster than the positive sentiments that are out there. And I think part of it is culture, part of it is the politics that we're in, what state you're in and what information is available and how it's being disseminated. Here in New York, I would say to you that every hour we're getting 2 or 3 messages a day on vaccination, why it's important to wear our mask, why it's important to get our kids vaccinated, why the booster is important. And I visited my mom in Florida, over the summer, and there was basically no information going out. So it's very, depending upon where you are. So you need to remember people are also, in some ways, information deprived from the right things. Next slide, please. And I just wanted to show this as an example. This is just one example of a person who's like an influencer using social media who, puts out this one comment that's inaccurate, and how quickly the message gets picked up per hour. And by the end of the day, in one day, it's made 12.6 million impressions. And so we can't just kind of say, this is not our issue, we can ignore it, this is someone else's job. I think as trusted healthcare professionals, members of the care team, we play a really essential role in amplifying our voice and helping to educate our community. Next slide, please. This is a visual. Hopefully it'll play.
It won't, but I can share my screen right now so people can
Okay.
see the
All right.
visual. So give me 1
Thanks.
second. No
So,
problem.
so I wanted to show a visual of that same kind of, tweet thing that went out. And every time you see this pulse or every circle, it's a social network that's picking up that particular inaccurate message and continues to be spread. And so as we click or share, we're actually helping to amplify that wrong message. And it's reaching so many people that's causing a lot of harm. So influencers play a big role. I think last week or 2 weeks ago, NAC hosted a session on social media and how to leverage micro influencers. And we need to identify some of those people in our community and learn how to use them to help combat or debunk some of the information that's being sent out in our communities. Next slide, please. And this is a concerted effort, again, that this is our clinicians, depending upon where you are in what state, that they're purposefully spreading disinformation and causing a lot of harm. There's a paper out on, recommending both on the physician side and nursing side from professional organizations that, we should consider removing the license of people that are doing this type of harm. Next slide, please. And this is our second poll question. So
Thanks,
what do
Wanda.
you, sorry.
No, go ahead, please.
Okay, sorry. This is our second poll question, and it's, what do you think is the economic impact of as a result of mis and disinformation per day?
So folks, we'll go ahead and give that about 2 minutes. I know a few people said that the poll buffered for them the first time, so I went ahead and dropped the poll into the chat just in case you were one of those folks that couldn't vote in the poll previously or in the first poll. But it should have popped up on the far right-hand side of your computer screen. I do see some votes coming in. Thank you for that. And if, again, it's buffering or you just can't vote, feel free to click on that link. It's just going to open up a web browser and allow you to vote. Just make sure you select your response and hit send so we get that. And I'll give it again about 1 more minute to let people vote. And then Wanda will share our lovely results. Needs a password. I can grab that for you, don't worry. 1 second. It's weird as the host, it tells you one thing, but as an attendee, it gives you something else. So that's no problem. Give me a second. Oops. There you go. Copy this. And where is my lovely chat? There you go. Yes, technology gotcha, right? So it's a weird, I didn't make up this password, folks, I promise you. So this is technology. So that's the password if it does ask you to get in there. So again, we'll go ahead and give it about 30 more seconds to let people vote. I definitely would have made the password tremendously easier, like NAC. Thanks, Jessica. Awesome. Thank you. All right, let's go ahead and close this off. Where's my stop button? And lock poll. All right, Wanda, there you go.
Okay. So, yes, the amount of harm and costs is between 30 to 50 million per day. And I think given the ongoing struggle that we have globally, I can imagine it's even more. I think it's important to kind of frame that with Tara, I kind of set what were our observations from listening to patients and staff from health centers, and then bumping it up to the next level to kind of real strategic advice as to how we can play a role in helping to combat this. Tara, you're up.
Great. Thanks so much. I'm actually going to share my screen so that I can sort of drive. Oh, we need to.
There you go. I'm giving you the presenter privileges now, so you should get in about a few seconds. Yep, it's
Okay,
starting to switch
there we
over.
go. Okay, well, thanks so much for having me here. And Wanda, thank you so much for that great intro. I think it really sets us up nicely. As Wanda gave some other examples, health-related mis and disinformation isn't anything new, right? It's something that we have seen for a long time, but there is something here in the spread via social media that makes it, um, you know, much easier to have this misinformation spread and spread quickly. Um, but this is a great example, really, of something that I found on the internet and I really wanted to believe was true, but I wasn't sure about it. And having that questioning mindset, I think, is really important for everyone, not just certain people who are inundated with misinformation, but us as well, who have a little bit more of information that's coming to us from really good sources. Because um, these can be skills that you model for everyone, as to how you sort of judge and vet information. So the first thing I did here was I checked via a fact checking website to see if this was true. And this was actually a real cartoon and not something that someone made a couple days ago and put on the internet and said it was from the 1930s. It was, in fact, from the 1930s, and it was published in the American Public Health Association. Some other tools that you can use to check for false information, or that you can suggest to others to check for false information, is to use web-based tools to assess source credibility. So one of the tools that I've used with my team is NewsGuard. It goes through a list of checklist of different things for different websites to make sure that they're operating in ways that are responsible. Another thing you can do is to verify with other news sources that fact that you're looking for, or look on fact checking websites. Even if you just Google fact check and the thing you're asking about, usually there's something that's useful that comes up. Reviewing content on the source, if it looks like one person's blog, that's a sign that I think you should take a closer look. Now, there have been really great blogs that have been helpful in the interpretation of new data from the pandemic. But I think overall, if there's not a lot of editorial oversight on the website or on the source, this is a sign of, at least a red flag, to take a closer look. Be wary of those messages that are designed to appeal to your emotions. We all know the clickbait on the bottom of the website, right? Misinformation operates the same way. It's designed to suck you in. And so this is something to be wary of. Also, another thing that people can do is increase their awareness of disinformation tactics so they can recognize them when they come across them. This can include, sometimes there's actually a game that basically gamified disinformation. It tells people, like, it's a game that people play, and it uses disinformation tactics, or at least people are sort of trying to use disinformation tactics to win. But by using them, they become more aware of when they see them out in the wild, basically. And then the last thing is just to understand your own personal biases and capacity to change opinion when presented with new evidence. This is something that everyone can use, and certainly something to model. But before we get really going here, I wanted to take a minute and just sort of describe misinformation and disinformation, or just define it, right? Misinformation is information that's false in this context of the scientific understanding of the time. And we all know from the course of this pandemic that science evolves, we learn new things change. So in this, in here, misinformation, we really want to say, okay, in the context of the time, because, we don't want to say the information that was good based on what we knew at the time. You don't want to always be going back and say that person was spreading misinformation. So this is often the result of ignorance or poor understanding, and that is different from disinformation, where that is purposefully created and purposefully disseminated. So this is something where people are lying on purpose, usually for some sort of social, political, or financial goal. My team divides misinformation into 4 rumor types. So the first one here, false cures, that came out a lot at the beginning of the pandemic. Chlorine dioxide, or the silver solution, these types of things. Even as simple as like garlic or whatever. Some of them are harmless, but you don't want people saying, "I'm going to take this false cure over something that is proven to work," or waste their time and money on it. Another one here is mischaracterizing the disease or the protective measure. So this is, as Wanda mentioned, or one of the people in her focus groups mentioned the microchip thing, or saying COVID's not real. Just sort of describing what you're talking about just completely wrong. Another thing you see a lot of is scapegoating, and this is from June 2020, this headline, but unfortunately, Asian American assaults only increased since I pulled this headline. And so this is, problem with trying to blame the pandemic or blame things on somebody else, using this misinformation to do that. The fourth bin we have here is conspiracy theories, and often those include profiteering. Here's a picture of me that my analysts found this tweet in our data set where we were looking for misinformation. And so we had developed a very large scale pandemic exercise in October 2019. We ran it in New York, and this video is me. It's since been removed by Twitter, but it was me in this exercise talking about, in this fictional exercise about misinformation and what countries were trying to do to stamp out misinformation. And it was used in its own misinformation to say that we practiced how to basically suppress free speech. So it's very meta, and both horrified and amazed to find this in our data set. So conspiracy theories abound these days. I just want to sort of mention that, another sort of piece here, just a sample of misinformation and disinformation campaigns that have been around. There's Operation Denver. There's a Russian disinformation campaign suggesting that the US had created HIV/AIDS. We have tobacco in the US. We have pamphleting related to measles vaccination amongst ultra-Orthodox Jews in New York. We also have what was going on around about Ebola in the US. And I want to just take a minute here to go dive in a little bit more on that last one. My team did an analysis on Ebola tweets and misinformation. And one thing that really came out of that I want to emphasize to you is that we all think about information often in black and white ways. Like, this is true, and that's very obviously false. The renowned NSA whistleblower, Ebola could be a staged event to pillage Africa's natural resources. That is obviously false. And it's easy to see these types of things, the microchip thing, all these very obviously false pieces. But misinformation and disinformation often is this gray area where it's half true, or it's misinterpreting the truth, or it's based on, there's a kernel of truth there, and it is twisted and twisted and twisted in such a way that then it is misleading. But the kernel of truth is there, and that makes it even harder to combat this. So here is an example. There's an Ebola patient in Fairfax County Hospital. I'm going to Canada. There was someone who was being evaluated for Ebola in Fairfax County Hospital. That person did not have Ebola, but because they were being evaluated for it, allows someone to suggest that there is Ebola there, and that people should be really worried about it. So this is an important thing to remember, and obviously I'm sure that you guys are dealing with this all the time in your practice. Here the final sort of count was that we had 5% completely false and 5% partially false. Now that makes up 10% of the tweets we looked at. Is that a lot? Is that a little? It probably depends on the network you're a part of. I'm not probably getting many of these, false or partially false tweets coming across my Twitter feed, because I don't follow people who are spreading that type of information. But if you're following a large group of those people, you're going to see them all the time. I also want to emphasize just one thing here about COVID, or whatever the topic is of the day, can often be, and in this case, Ebola, can often be a vehicle that's used to promote discord or provoke a response, right? It is the topic of the day, everyone's talking about it, but people who spread misinformation and disinformation often use it to sort of spread a different sort of message. So here we have an example. I won't read them all, but this lower on the right one, GOP is worried about Ebola getting over the border. Mr. Duncan flew in legally. He didn't sneak in from Mexico. And in this case, it's even more nefarious, because they've hashtag TCOT, which is a conservative, hashtag MP2, which is a progressive hashtag. In this case, it's trying to start a fight. right? This isn't just about spreading misinformation and pushing one narrative versus another. Another sort of nefarious piece of disinformation is using narratives to create a social division, which then sort of exacerbates discord in this country. And, we can see that we have a lot of that already. And, this is just exacerbating an existing situation. So if you look at a couple other interesting findings, just to mention, 42% of the tweets we looked at contained risk elevating messages. Most frequently, we saw most frequent rumors were about government conspiracies. And again, like I mentioned, these tweets containing misinformation were statistically significantly more, they more often promoted discord, were political in nature, were risk increasing in nature than tweets without misinformation. So, misinformation is part of that sort of vehicle, or it's a vehicle, and it uses misinformation to promote these other sort of things that are going on. Now, I just want to sort of go to COVID-19 here, get off talking about Ebola, and sort of just mention, hey, we've got an infodemic here. This is where we're talking about the rapid, large-scale spread of health information and misinformation through all these different media and information channels. I mean, we are just, so much information is coming to us, and it's very difficult to sort of even process it. You close your ears, you pick what you want. It can be very difficult for people who don't do this as their line of work to figure out what's going on. And this overabundance of information is, some of it's accurate, some of it's not. And it really makes it difficult for people to differentiate between true and false. They're using mental shortcuts, the groups that they belong to, social connections to make these decisions about what's true and what's not. And that can be very dangerous in some situations. When it comes to sort of COVID-19 itself, we've got a collision of many factors that make this even more complicated, right? So we have a novel virus, we have limited and emerging information that's changing as we learn more. So you really already have a trust deficit. We have few countermeasures initially that really increases fear. We have expansive social, political, and economic dimensions of the pandemic. We have existing social unrest and division. And we have expanding access to the ability to provide content. So, anyone can make a website, anyone can, put a social media post out there. We also have a large and monetized media market. So there's a lot of money to be made out there. And finally, declines in science and digital literacy. How do you, stay safe on the internet? How do you parse scientific information? How do you understand how science works? And how do we deal with uncertainty? Those types of things. Now, here we have the answer to our poll quiz. And I just, put sticks and stones here because I think everyone thinks, these are just words. Who cares? Well, not everyone thinks that. Many people think that. But really, we know that it has meaningful impacts in the real world. So, COVID-19, our team led by Richard Bruns, our economist, did an economic analysis of COVID-19 vaccine misinformation as it relates to the choice to get vaccinated or not only, right? So not the whole, I don't believe COVID is real and all that. I'm just limiting it to vaccination. And there is a lot of uncertainty in this analysis because it's very hard to nail down someone who wasn't going to get vaccine no matter what, versus someone who doesn't get vaccine because of misinformation. We have a lot of polls that tell us that people are exposed to it, but does it translate into their actions? That's why we have such a wide uncertainty bar. We have $50 to $300 million every day that it costs. And that's not during a surge like Delta and Omicron, right? That's during a normal sort of like what we experienced in June and July. And that means, though, that an effort that reduced misinformation, that reduced the misinformation that then reduce non-vaccination by like 10% would really be worth between 5 and 30 million per day. That is like a huge return on investment. So I think it's worth doing something here. How can we be thoughtful about what we want to do? So, in my line of work, we do talk about large-scale policy change. One thing I want to talk to you very briefly about is a national strategy. This picture is from a congressional briefing testimony that I did in March 2020. You know, like, geez, there's a lot of people here and they don't have masks on. This is like, you know, the before times. And now we're kind of getting, I mean, I'm getting a little like heebie-jeebies just looking at this picture. You know, we want to be able to include social behavioral concepts in tech development, right? It's not just, you know, if you build it, they will come. We know that we need to do more than that. And so we need to, you know, incorporate that into the research that we do. Doing some forecasting about mis and disinformation. I think that we can expect certain mis and disinformation. We need to be able to plan ahead for it. And then also making an investment in public health communication. You know, I've done a lot of research projects where I've interviewed public health communicators from health departments, and they say, "Well, I'm the only one here, so how am I supposed to do all this?" And this, you know, this is something that we need to invest in here. So just to briefly go over a national strategy that our center has sort of put together, or actually it's an approach to a national strategy. It's not a national strategy itself, but we're thinking about how do we approach a national strategy? We have 4 pillars. And so one of those is controlling misleading content and sources. And this means we got to, you know, prevent it from getting out there, prioritize this as a national security issue, establish a national commission separate from government, but you know, convened by government to provide guidance and recommendations, and encourage active, transparent intervention from social media and news companies. But I think, again, this is something that requires all stakeholder involvement, and I'll talk about that a little bit more. But I don't think we want social media or the government determining what's true and what's false for us. I think the second thing here is to promote factual information, like I mentioned before, prioritize public health risk communication, and also coordinate more between you know, social media and news media and these public health experts and medical experts. The third pillar here is to increase public resilience. And this is actually where I think we're going to need to really focus, because I don't think we're ever going to make sort of the social media stream pure. It will always be somewhat poisoned by misinformation. And I think we need to help people sort of become more health and digitally literate in schools, community organizations, you know, social media, news media, others. And this isn't just about teaching this in high school. This is about also going to retired person groups, talking about this with older folks who, you know, haven't grown up with the need to sort of figure out how to vet sources. So it's not just young people. And the other thing here is to provide resources for public verification of the content. So fact-checking sources, digital tools, things that people can trust if they're you know, disinclined to trust you know, government or folks like that. And finally here, you know, this is not just a situation where one group can do something and it will fix the problem, right? This is, everyone has to be involved: social media, news media, the government, you know, public health, scientists, you know, people from the medical field, but also the public, right? We all have to take a close look in the mirror. And then coordination across the government. You know, I just find that when I talk about this, you know, defense, people who are more on the security side, you know, they're working on the same thing. But when we talk, we are not speaking the same language. And so a lot of times I think that we need to sort of coordinate that, because people are doing a lot of work. But I think a unified strategy is really what needs to happen, because otherwise I think we're going to just keep kind of doing a whack-a-mole thing and failing, I would say, as we have in COVID-19. So quickly, just to kind of talk about some legislative efforts that have been out there. You know, we have Section 230 legislation on health misinformation led by Senators Klobuchar and Lujan, you know, holding social media companies liable for harmful health-related misinformation. But that is as determined by HHS. And I feel like that's a bit of a black box. You know, concerns about transparency and people already not trusting the government. So I think that there needs to be some modification there. Representative Swalwell also did put in some legislation for a national strategy to combat biodefense misinformation. I'm not sure how far that's going to go, but it is a good start. And then local governments have started to work to declare misinformation as a public health emergency. So San Diego County did it, Sacramento County, Monterey County, the California State Assembly were thinking about it. And this really follows the Surgeon General's report on trying to sort of bring all stakeholders into this solution set. But just a few more tips before we hand it over to questions. When we're responding to people who believe false information, you know, and you guys have been putting this into practice already, so I don't really know if I even need to tell you this, but the first thing, of course, is to engage respectfully. No one listens if you just start off by telling them they're an idiot. So engage respectfully, connect on the same values, right? We all want people to be as healthy as possible. We want them to be safe. We want them to live long and healthy lives. So we're connecting on values. Some people, this is what is really nefarious about misinformation, that is pinging on these values that people hold, people who really focus on independence and freedom and those types of things. And so we need to connect to other values that are equally powerful for people. Talking about tactics, like I mentioned, how misinformation draws you in, discussing alternative explanations for the fact that they're really concerned about, or the issue that they're very concerned about. Encourage them to verify. And then that leads you sort of to the last thing, providing true information and alternative information sources. And that can be very tricky, because if you're encouraging verification and they're just going to some crazy website to verify what they already feel is true, then that's not helpful, right? We need to talk about what information sources that they're willing to trust, that we think, that are also, good information sources. And that can be difficult, but you can send them to, their local health department. Hopkins can be a good source, if they're unwilling to trust CDC or WHO. You can look for other organizations within your networks that can help people sort of find that information that they're looking for. When you come across false information online, or if you're not talking to someone, you just like run into it. This can be, you first of all decide if you're going to engage, right? Because sometimes it's just not worth your time. So I don't promote, and the other thing is don't promote the lie, right? So you can sort of, and I've sort of modified my thinking on this, right? You can mention the thing, if we're talking about like, the chips in the syringes, you can say like, well, a chip wouldn't fit in a syringe, right? But don't like retweet the original post and then say this is untrue because whatever, because then people are just going to go to the original post, click on it. You have spread now, maybe some real crazy dude wrote it and reached like, a couple hundred people. Well, now you're helping to spread it to thousands of more people. So, just be careful about how your actions in refuting it can also sort of promote it. Like I mentioned, limit engagement if you don't know it or it's not legitimate. It can take a lot of time. Report it to social media companies, and also just make sure you provide true information. We have some critical needs here, right? Maintaining and building trust, trusted community members. You guys are trusted community members. Being transparent, collecting data, sharing it, telling people why, things are going on. Engaging with identity, like I mentioned before, those values, right? Core beliefs, affiliations, listening to what concerns are and what personal priorities are, and communicating uncertainty, right? Like foreshadowing change. What new information might cause you to change your recommendation? Identifying what's known, what's not known, what's being done to fill those gaps is really important, because that uncertainty, there's just so much, even now, that I think that people need to understand those things. Some future efforts that I'm thinking about, anticipatory pre-bunking and debunking, thinking ahead about what, you might be seeing, the long road to rebuilding public trust in public health. This is going to be a long endeavor, and it is daunting to think about it. I'm helping select populations. So here I have a link to a course that, helps someone be a vaccine ambassador, talking to parents about vaccinating their kids. So this is actually can be very helpful. It's a Coursera course from Johns Hopkins. And then policy that reflects the needs of today, right? We want it to be transparent with clear definitions. We want it to be restrained. We don't want it to go overboard and start to infringe on speech. And just before we end here, I just want to thank my team. Richard Bruns in the middle, he's our economist, Divya Hosengadi in the upper right, Mark Trotashad, Annie Sundelson, and John Ross Ford. I couldn't do any of the work I do without them. So thank you very much, and I will stop sharing.
Thank you so much, Tara and Wanda. Really appreciate it. So just a friendly reminder, folks, there are some resources that caught just popping into the chat right now. I do have some pre-submitted questions and have an opportunity to answer some questions through the chat. So again, in the lower right-hand side of your computer screen, simply type your comment, question, or concern into that box, and we do have some time to answer that. So for Tara and Wanda, a question that came in pre-submitted is, how can we debunk the idea that people who have had COVID does not need the vaccine or a booster?
I would say that they have, one is education. I think that they don't understand that your immunity, even if you've had COVID, is not the same as if you are vaccinated. And boosted, and you're also at risk for getting it again. So I think what I observed from the listening sessions was a lack of clear understanding. And so first listening, providing accurate information for them to then make an informed decision. And that was part of what I learned from the stuff that we did. Tara, what are your thoughts?
Yeah, so that's one of those things where there's sort of a little bit of a kernel of truth, right? People who've been sick before have a little bit better immunity. And so I think it's important to acknowledge that and say, yeah, you do have a little bit of a boost as compared to someone who is unvaccinated, but you can protect yourself even more by getting vaccinated. And you want to live a healthy life, and you talk about their concerns, right? For me, my concern would be making sure that I'm able to take care of my kids, right? I don't want to get sick again. I don't want to get them sick. I don't want them to miss school because of me. But understanding what their concerns are, right? If they're someone who's worried about missing out on work, what are the options at their workplace that can help them, take a day off if they're going to feel bad from the vaccine? Are they worried about side effects? Those types of things. So kind of going into those details, I think, can help people. But really, the emphasis is on you do have a little bit of a boost, but you can make yourself so much more protected and so much more able to protect your family, your clients, whatever, by getting this vaccination.
Awesome, thank you. This was a question or a comment, I'm not entirely too sure, but this comment that they would like to know more about education directed to parents of school-age children.
Yeah, I'll just mention so the chat that Katja made at 2:51 p.m. with the Coursera course in it, that is a great resource for people who are trying to talk to parents about getting their kids vaccinated. At this point, even people who have been vaccinated are worried about it with their kids. But I think, I got my kids vaccinated. I think most people who have been in public health, who are physicians or doctors, have gotten their kids vaccinated. It protects them from all kinds of potentially bad outcomes that can occur, and also just makes your life so much more straightforward. You don't have to have your kids isolate when they have or quarantine when they have a close contact. My kid gets to go back to practice where everyone else has to go get a negative test. So I just think it's helpful in a variety of different ways.
Awesome, thank you so much. And then our next question that's come through what are some of the historical or social missteps that English-dominant Western medicine may unwittingly push certain communities towards mis and disinformation?
I mean, one is to you don't want to come across as elitist, right? There is a lived experience that needs to be respected, and knowledge that we need to listen and at least state where is it that their perspective is coming from on this issue. I will say that part of what I observed from speaking to health centers was that there were pockets in some of our communities where there was really a big gap of information. Things were not available in their language. And what I find is that health centers are ahead of the curve in that domain because they care and know those communities. So that was one big observation for me, was that lack of info that was going out. But I think one is just kind of understanding how family comes together, how they share information. They tend to be a little bit more, because information is not as readily available to them in the language that they predominantly may speak at home. They tend to be smaller circles and tighter knit. So I think health centers, to me, Sarah used the phrase earlier that where there is a a trust deficit, health centers are not in that domain. We are trusted. So we need to leverage those opportunities to reach the community. And I think many of our own staff reflect that community. So we're ahead of the game, I think, when it comes to understanding those cultural differences and have cultural competencies that others may not.
I want to. I think that's exactly right, and I just want to add that I think that sort of a patriarchal, like doctor knows best approach, medicine, that the values of the public health community and the medical community are preeminent, has really not served us well in this pandemic, because people say, "Hey, I have thoughts about that too," and I want to be part of the decision making. I think that my opinion has value, and it certainly does. And I think having additional stakeholders be part of these decisions would have, I think, helped not become quite so political. But I think that now we just need to sort of have these conversations amongst people and in their groups and get to trusted mediators, especially because I think that people have lost trust, and we're not going to be able to build trust in an emergency. You don't build trust, in the moment. You lose trust in a moment, but you don't build it in a moment. And so I think we need to sort of work through people who are already trusted in their communities at this point.
I'm just going to quickly respond to something I saw in the chat about when people think about, being tracked and that they're using this stuff to track us. Correct. That if you're using a smartphone, there's a lot of data being shared about us on a daily basis. You go when you use a credit card, information is being tracked. Like these databases on us already out there and exist. There's way smarter ways to track what we're doing besides the vaccine. I think the other, just want to, because we're running out of time, but I will share that the centers that took a forward-facing public, I think, strategy to work with partners and promote messaging in their communities got ahead of it. So working with faith-based communities, using our own staff in the waiting room, playing videos with our own staff, being able to provide education, our key strategies, and using platforms to our advantage and leveraging them, like Facebook, and hosting town halls where you're answering questions to your community is important, especially if you're able to deliver it in their language, because I think that's a big deficit in certain components of our country. I mean, I was a little shocked that when I interviewed some of the one of the a patient group, I think it was in the state of Ohio, they didn't have Spanish speaking channel available to them, so they relied on radio. So you need to think about all these other outlets in order to get the word out. But predominantly, over and over again, what we did here, and I think it's credit to all of you for working so hard and being so committed, that you're trusted. So leverage that and help combat some of this, because it's an ongoing, as Dr. Sarah Sell stated, that unless we're on it, it's going to continue to kind of give us this no end in sight. There's a lot of resources here. Please, I encourage you to visit them. NAC has a whole bunch of resources also accumulated. Personally, if you're trying to kind of get a little smarter about using some of this stuff and how to engage, we have some resources here. I personally go to First Draft News. They have this kind of quick little toolkit on helping me to understand mis and disinformation. And I'm a person who uses social media all the time, but I'm always about embracing lifelong learning. We're never done. And it's our role and responsibility as advocates that care about our community and patients to get ahead of this and help our community heal. Thank you, Dr. Taracel, for joining us today, and the NAC team, and everyone who joined us.
Thank you. See you
Thank
later.
you guys so much. Have a great afternoon. Thank you.
Bye-bye.
Bye.